This morning, a holiday health warning as cases of the norovirus surge.
Norovirus decided to be our last little Christmas gift.
New data from the CDC shows an increase in outbreaks, with 91 reported in the first week of December across 14 states, more than double the number for the same week over the past 3 years.
Is there any reason why we're seeing this rise?
Gathering together, especially this time of the year, and all the traveling we're doing, that's causing the increases.
The highly contagious virus, commonly referred to as the stomach flu, can cause days of vomiting, gastrointestinal problems, and fever.
I promise you, you do not want this.
Norovirus can be spread through direct contact with an infected person, touching contaminated surfaces, or eating contaminated food.
If you have been sick with this, I'm sending you all my love because it's no joke.
Now, with millions expected to gather for New Year's Eve celebrations, health experts say it's important to take precautions. Wash produce thoroughly, don't share utensils, and don't rely on hand sanitizer.
You know, we all have this around the house, the hand sanitizer. This does not work very well for norovirus. You need to wash your hands, that 20 seconds we always talk about.
As we head into the winter months, health officials say cases of the flu, RSV, COVID, and norovirus are all on the rise right now. The flu is the biggest concern now, though. The agency reports a 12% jump in positive flu tests in the last 2 weeks. More than 12,000 Americans are hospitalized with the flu. Norovirus is another issue with dozens of outbreaks across the country, and RSV and COVID cases are rising in all parts of the U.S.
If you start developing any respiratory symptoms, you need to get tested.
The CDC is now predicting respiratory virus hospitalizations could be as high as last year, despite a slow start to the cold and flu season.
Bird flu is getting a lot of attention right now, with some experts worried it could become a major public health risk.
Now the CDC also warns multiple viruses are surging. As Amy Kiley reports, the result could be a spike in related hospitalizations.
If you start developing any respiratory symptoms, you need to get tested.
The CDC is warning of surges in flu, RSV, norovirus, and COVID cases. It's now predicting respiratory virus hospitalizations could be as high as last year, despite a slow start to the cold and flu season.
Those of us in infectious disease always worry about influenza.
The CDC reports a 12% jump in positive flu tests in the week ending December 21st. It says more than 12,000 people were hospitalized with the flu then. Right now, health officials say influenza A is the biggest concern, but experts are sounding the alarm about bird flu.
There's a lot about the bird flu and how it's mutating that we don't know about.
There's no yet cases of human-to-human transmission. That can happen at any time. Once that begins, we are indeed in for another pandemic.
Norovirus is another issue. Many people call it stomach flu, although it's not a type of influenza or even a respiratory illness. The CDC reports an unusual spike in norovirus outbreaks this month.
We are also moving into RSV season, respiratory syncytial virus season.
Health officials say the number of RSV cases is high and is increasing in most areas of the country. And young children are especially at risk. They say COVID cases are on the rise, too.
The good news is we have testing for COVID and for RSV and for influenza.
California is now the first state to be under a state of emergency over the rising cases of bird flu. More than half of the 61 human cases nationwide have been in California, with most of them in farm workers exposed to infected cattle. Today, we learned about the first severe case of bird flu in the U.S. It's a Louisiana patient who was hospitalized after being exposed to sick, dead birds. Health officials say so far the virus hasn't been spread from person to person.
Meantime, a doctor who served in the first Trump administration is now issuing a warning about the potential threat of bird flu. Former White House coronavirus response coordinator Deborah Birx says the U.S. has not learned lessons from the COVID-19 pandemic. Birx says the bird flu is starting to show signs of its own pandemic potential. This comes after the virus mutated inside a Louisiana patient who came down with a severe case of the illness.
A person in Louisiana has contracted the nation's first severe case of bird flu after the virus mutated inside their body, allowing it to more easily infect their upper respiratory system. Dr. Celine Gounder is with us to explain. Dr. Gounder, when you hear the words bird flu, severe case, should we be worried?
You should be concerned about how the U.S. is responding. However, at this point in time, the threat to the general public remains low. So this severe case of bird flu occurred in a man in Louisiana. He's over 65, has underlying medical conditions, was infected by a backyard flock of birds. The key thing here is also that there has been no human-to-human transmission, including in this case. But what is significant about this case is that the man did develop severe disease. We saw a mutation that appears to predispose to that. And the more we allow the virus to spread, to mutate, the more you increase the odds that you'll get mutations that can cause human-to-human transmission, that can cause more severe disease, and that's how you get a pandemic.
What is being done specifically right now to combat that human-to-human transmission that you're talking about?
We really should not be banking on luck. What we need to be doing is a whole lot more testing so that we understand how the virus is spreading, how it's mutating, so we can stay ahead of it.
All right, Dr. Celine Gounder, thank you so much.
Right now in Louisiana, there's a person fighting for their life on a ventilator from bird flu. That's a type of influenza that person picked up from handling probably some dead birds on his property. There have been 60 cases of bird flu, most of which have had mild symptoms and people have gotten over, 30 in California. California has declared this a disaster and is declaring this a major problem and are looking out for it. Why are people so worried about bird flu when some people just get over it? We have been worried about bird flu for a long time, and we have been watching out for it for a long time. By the way, I'm Dr. Terry Simpson. Besides being a surgeon, prior to this, I was a virologist and actually trained in virology and have published in this field. If you're interested in information, give me a follow. Here is the problem. Bird flu is highly more contagious than coronavirus ever was. Coronavirus, remember, if you can think back to February of 2020, started with just a couple of cases that came to the United States before it went out like a wildfire. We're very concerned that bird flu would be even worse. The last major pandemic that we saw about this was the Spanish flu, unfortunately misnamed, which cost the lives of about 25% of people in the United States, effectively targeting individuals who are young men and women. Now, we don't know what the bird flu will become, how it will become, or what it will become. We do know we have better tools against it. We do know that we can develop a vaccine against it very quickly with mRNA technology, which of course will create a controversy among the anti-vaxxers. But be vigilant. Bird flu is something that is here to stay and will probably start creeping through the population. And if it makes the leap where it goes from human to human, we are going to have a major pandemic on our hands, and we will need to be careful again. I know nobody wants to hear this. Nobody wants to think about another pandemic. The last one was horrific in a lot of ways, and we've learned a lot of lessons from that, but we just don't want to have another one. So do what you can. A, don't play with dead birds. Don't pick them up. Dispose of them very carefully and make sure you take care of the instruments of disposal. Number two, don't drink raw milk. We have found bird flu fragments in that. Drink pasteurized milk. That's the one thing you can do. And number three, listen to your healthcare professionals. They will help guide you through if we have to go through this again, and God help us, I hope we don't.